Rossi, and this is Secrets of Deep Tissue. And this class is really going to be covering a lot of conditions, the most conditions that I've treated in my clinics over the years, and I'm going to give you a chance to find new ways to approach those. And you know, my background, I've given over 20,000 massages in my lifetime. And that might sound really impressive. But if I did the same massage over and over and over again, never changed anything, never made something better, or never corrected things I learned wrong, that doesn't make the massage any better. So those 20,000 massages really don't mean a lot, and we'll discuss more about that in a moment. But you know, over the years in my clinic, I got out of massage school, and in reality, when I was in the massage school, they teach a technique, and I think, well, there's a better way to do that. And it goes back to my days as a kid in junior high. My mom was trying to find the ultimate cheesecake recipe. So for a month, every other day, my mom made a new cheesecake. And she'd say, oh, what's this like? Is it like the flavor? Is the consistency, the texture? And I'm like, oh my God, Mom, I'm starting to not like cheesecake, you know. But she finally found the ultimate recipe. So when I went to massage school, I thought, I know, you know, I'm an experiment. It even goes back before that. Before I entered school, I had nothing to do for about 3 months, and I ended up teaching classes for the Jenny Craig diet centers and taught nutrition. And even then, they gave me clients that weren't sticking to the program. And I was the one who was supposed to browbeat them into behaving and living for their kids and that kind of thing. And so I would experiment with them and say, well, I'd have my clients drink a half gallon of water a day and half my clients drink a gallon of water a day, and realize that those who drank a gallon were able to get their weight off faster. So I carried that experimentation off into massage therapy. So as a therapist, I would compare half my clients with a certain low back technique and the other half with a different low back technique. And those who got better quicker, I'd keep that technique and toss out the one that wasn't working so well. And I kept doing that throughout my first couple of years as a therapist until I found the ultimate techniques that were getting folks better as quick as possible. And all massage therapists, and all actually even physicians that teach CE classes for massage therapy, really have a background. Anybody here know Paul St. John? His work. Paul came from a radiology background, and Paul was a radiology assistant. He was working with his physician he worked with, and he taught him a lot about bones. And so, you know, Paul's philosophy really comes from bone length and those kinds of things, and deviations and structure, and that really affects his teaching. And other people maybe have a background in engineering or a background in art or whatever, but those things really affect, as we are as teachers, it affects how we teach and how we perceive injuries. My background before I got into massage really was in engineering. I have a degree in marketing and business, but I went off and got a job for a steel building company. They build humongous, you know, warehouses, like for Costco. They build aircraft hangars for Boeing, just big steel buildings. So I got to understand engineering, and we'll talk about that later with some of the techniques that we're doing, how engineering really actually affects what we're doing. I also, when I went through school, had the opportunity to take a cadaver class through the Bastyr School of Naturopathic Medicine. Anybody taken a class in that kind of thing before? It's neat, it's interesting, but in reality, when you're looking at the body who's gone through that, back in the 80s, there's this thing called alien autopsy. And they had this, oh, they caught this alien, you know, and they're going to do this autopsy on live TV. It's kind of hokey, but it was funny. But that grayish, rubbery substance, that's kind of how we look after we've had all of our blood drained, after we've been infused with these chemicals, left in a body bag for 5 years. And then we get to go ahead and, you know, look at this specimen to cut up to see what the body's like. And so it's interesting, but it's not reality. It's far from reality. It's like me giving you a piece of beef jerky and saying, here, this is what a filet mignon is like. And you go, really? You know, so it tells you, you know, layers, and it tells you origins and assertions, but that wasn't really the real thing. And so I called up the local coroner here in Thurston County, Judy Arnold at the time, and said, I'd like to help with an autopsy. And this is before the days of CSI. And she goes, why? And I said, well, I told her I was starting a massage school, and I wanted to really get some more information on what the realities of the body versus what, you know, what I was told in school and what I had seen in my cadaver classes. And so she said, okay, well, I'll call you if we ever need you. Well, a year passes, and I finally get a phone call, and all of her assistants were sick, and I got to come in. Long story short, they hired me for 2 years, and I didn't pass out. I was intrigued when they cut the body open. I was really intrigued by that, and in that autopsy experience changed my reality. It changed what I saw as a massage therapist. You know, when you look at the body when we're in school, we're often shown this model, and we see this basic model in most of your schools, right? And this model is based on a cadaver. And so when you look at the psoas muscle on here, it's about this big around. Well, this model really is about my size. When you figure the hip bones and you figure the back of the neck, it's about my size, right? Well, when we opened up the first body I ever worked on, probably a weird way to say it, but when we opened up the first person for the autopsy, I realized that their psoas was the size of the wrist. And the next person we opened up, their psoas was the size of their wrist. And not to be gross, but in the United States, we have a Y cut. So we go from shoulder down to the sternum, nickel Y, and go down, and we shear back the fascia and the skin and fascia, the tissues in general, and muscles. And we pull this back, take pruners, and take off the breastplate, pull that back, pull the organs out. What's left is this beautiful sheen, this wrapping inside of the torso. And when you pull that back, you see these monster muscles on both sides of the spine, which are the psoas muscles. And again, they're the size of the person's wrist. When they're dehydrated and pulled of all their fluids, and they do get small, but this is not what the reality is. So that information really affected my teaching, and it affected what I saw and that affected my injury treatment techniques as well. Not to be mean, but all of you are sitting down right now. Even if you're the most fit person in the room, if you were to sit on a clear chair, and if we happen to have a camera looking at your butt from below, is it possible your butt might look slightly whiter than when you're standing up? Yes. So imagine if you have a body that's dead in a body bag for 5 years, possibly the back sides of that tissue tends to spread laterally. And that's also true, in general, the bodies that I saw in my cadaver class. But a lot of artists that draw don't get to see autopsies. They don't get to have a fresh specimen to draw from, and so they drew from a cadaver class. And so when you look at books that you have, some books are written or drawn wrong, like on the quadratus lumborum. Oftentimes they're drawn more lateral than they really are. And really, in reality, when it's tight and the structures and being functionally working together, the QL is directly below the erector spinae. And so a lot of times we're being taught things like you're going too far lateral to hit the QL, when in reality it's much more medial. So those pieces have actually changed my technique. We'll discuss that when we show the actual technique in the class. It's interesting that I know all of you are honest people and you never tell a lie. Ever. Except when you go on vacation to get a massage and you have your intake form and it asks what you do for a living, what do you say? Self-employed, right? You don't want to say you're a massage therapist because you don't want to discuss massage your entire massage, right? You just want to lay there, relax, and just say... So I was getting a massage from a woman a number of years ago in a city that I won't mention in nearby, and I wrote down self-employed, and she's trying to, cautiously, carefully ask questions to figure out what I did, and as she's going up my back, she's successfully hitting every single rib. Funk, funk, funk. And I said, could you go a little more medial on top of the erector for me? And she goes, oh, are you a massage therapist? Dang it. So, yeah, and so she, I was trained by so-and-so, and I've been doing this for 14 years, and then blah, blah, just kept going on and on how exciting her training was. And then a few moments later, she puts her elbow in my calf and deeply and quickly goes towards my foot. That's the sound I want to hear. Certain states, I say that, and they go, is that a problem? Yeah. I won't say which states those are, but... Anyway, so she was bragging about how she'd been trained and how long she'd been doing it. I'm thinking, oh my gosh, she's been doing this technique for 14 years. How many varicose veins has she given? Well, I instantaneously got a varicose vein when she did that, right? So I heard in my leg and I went, really? And so just because you've done something for a long time, a lot of therapists say, well, I've been a therapist for 30 years, and that's great. And certain therapists say, well, I've only been a therapist for a year. Well, if I had to have, brain cancer done, and I had a choice of a physician fresh out of University of Washington Medical School, or a doctor who'd gone to school 50 years ago who had no additional continuing education, who would you want your brain surgery done? You want the information, not just the experience. And if you experience and do things over and over and over again for 30 years, it doesn't make it right. So don't be embarrassed you've only been a therapist for a short while, and don't sit on your laurels that you've been a therapist for a long time. Keep getting new information. So that's what this class is about. This next story, I've already repented. I was wrong. It was unethical. I'll never do it again. What else can I say? My mea culpa. I had a guy come in, and we'll call him Dwight. And Dwight came in for a massage, and he shows up in his restored, really cool 1930s car, and he's got his hair slicked back, and he talks kind of like this. How you doing, And so Dwight gets his massage, and on the first massage, he starts talking about an affair that he's having. I'm thinking, okay. And the next time he comes in, he talks about another affair that he's having. But that day, his wife, his beautiful wife, and two lovely daughters drop him off. Oh, love you, honey, and gives her a kiss, and she walks off, and I'm thinking, if you're making a mistake in your marriage, whatever the case is, versus being a philanderer Okay. Well, next time he comes in, he's so excited. He's got 2 women lined up in the same day. And he decides that's the day he wants to tell me about this lady's body and how amazing it is. And this is how he's about to tell me about her too amazing. And I went, I don't want to hear this. And I went, in his back. It's wrong. Don't ever do that. But Dwight couldn't talk that day. Every time he went to talk about her body, I just dug in and he couldn't talk. Oh, this is great. Well, the next day I get a phone call from Dwight. He goes, Bob, guess what? I go, what? He goes, you're not going to believe it. I said, what? He goes, I'm pain-free. Think of all the people that don't deserve to be pain-free right now. But my point was that I realized I was comparing these techniques, but I wasn't comparing other aspects of that. And if I were to give you a box of ingredients, and I were to say, look, there's some sugar and flour and salt and baking soda and chocolate, of course, and say, go make something and come back at the end of the day, how many would you have the exact same result? None of you. Same ingredients, different results. So when you go to massage school and they say, here's your new technique for the day, those are ingredients. Well, if you take a cooking class and the most amazing chef in the world pulls out flour, you say, I've seen flour before, I know this. Really? Is it just the ingredients or is it the recipe? Well, good body work, especially this class, is about the recipe. A lot of techniques that I'm going to teach this weekend, if you've probably seen before, but maybe it's a small adjustment to that. Something you haven't seen, or maybe it's the duration, it's the frequency. So it's like with the baking philosophy on that, the analogy is that how hot is your oven? Well, if I give you the same ingredients and we put it in the same pan and we bake it for 350 for an hour versus 500 for 2 hours, completely different result, right? And so with massage therapy, with these techniques, if you look at these techniques and you watch them being done, you just don't turn it off because you've seen this before. You want to look at it and say, what's the nuances of difference? And sometimes the smallest change can make a technique go from being mediocre to being amazing. So it's about the recipe, and there's a number of techniques that I've developed on my own. I don't give myself credit for it because I don't care. I took a class from Sean LaSala Kimball years ago. She's a Hawaiian body worker. And I said, oh my gosh, I made that technique up like 5 years ago. And she goes, you remembered. Because the Hawaiians believe you're born with all knowledge. You forget it at birth and spend the rest of your life remembering it. I said, even nuclear physics? She goes, oh yeah. Okay. In my clinics, what this class consists of, these 28 techniques, really come down to what I saw most often in my clinical experience. So you think, why does he pick these things? Well, it's because these are what I saw most. And there's obviously a lot more things that you're going to find, but that's what these consist of. And in Washington State, we have labor industries, or L&I, or what some states call workers' comp. And what's nice about Washington State is you automatically get 6 massages, pretty much no questions asked. The next 6, you have to beg and write reports. And the third 6, you have to give your firstborn, and right? It's just really a pain. I didn't want to have to go through all the reporting. I still write a report the first time the person comes in, but I didn't want to have to beg for another set of 6. So my goal is in these techniques is to get people better in 6 tries or less. To aggressively work on folks, whatever's necessary to get them better versus going on. And there was years ago a meeting of massage therapists at one of the schools, is the Alexander School. We're around the table, and there's a lot of people whose names you probably know. And they're trying to make a tiered system in Washington State, kind of like the nurses have, right? You're an RN versus a LPN. They want to do the same thing with massage therapy. They wanted to have the medical massage therapist, which knew everything, and those who are just relaxation therapists. And so I'm just sitting there listening, which is unusual for me, and I'm listening to this one person saying, well, we have to break it up because the people have no clue what they're doing. And someone from the Alexander School said, relaxation massage can cure injury. And it's true. And I don't mean to be disrespectful to people who just do relaxation work, but water over 1 million years can dissolve any substance on Earth. I don't have 1 million years to get someone well. So relaxation massage, if you have all the time and money in the world, sure, take your time and do that. But I'd rather get you better, quicker, back to work, out of pain, and make you get back to your life so you can actually enjoy life and get going forward. So I found that if you're aggressive on certain techniques, you get a faster response than if I go gentle and take my time and go over a period of time. And a lot of people will say you should never ever cause discomfort to make someone well. It should never cause pain. Well, if you had your shoulder out of its socket, should we leave it out or should we put it back? And so it's going to hurt to put back. Or if your bone's been broken and you need to reset that bone, is that going to hurt to have put back? Well, yes. And so sometimes discomfort is required to get someone well. So where does pain come from? All the question is like, well, it's a bodybuilder quote, but no brain, no pain, right? Sorry. Okay, so there's no brain, no pain. Essentially, a lot of massage therapists, our goal, we think, is to treat pain, to get people out of pain. I disagree. I don't want to get people out of pain. That's not my goal. I want to get tissue healthy. If someone came to the door right now in a wheelchair and they scraped their leg on the door on the way in and they're bleeding, and they're paraplegic and can't feel their legs, and I say, hey, how's your leg feel? Feels great. Awesome. You're good to go. See you later, right? Well, no, I want to take care of the tissue and make sure he's well, not from how he feels it. And so there's this thing called, I refer to as the, this pain threshold that we work with, and people will come in the door, they get a massage and they feel better, get another massage and feel better, get another massage, and suddenly they're out of pain. Well, they're below that pain threshold, which is slightly different for everyone. If you're a woman and you've had a baby, your pain threshold's been reset. You have a different threshold of pain versus someone who's never had a baby, perhaps. So our thinking on pain is different for everyone. But what happens is when someone comes in the door and they go just below that pain threshold, they're a busy person, they got to get back to work, and they stop getting treatment. So on the first day someone comes in, I say, look, you need to continue until your tissues are functioning right, until your range of motion is back. Because if not, what happens is about a month later, after they feel they're not in any pain anymore, they're back with all their same pain, all their same problems, because you never ever got the problem resolved. All you did was get them out of pain. So our goal is not to get them out of pain, but to get the tissues healthy. Does that make sense? Okay. Next is, what does massage affect? What tissues does massage affect? Well, it affects all tissues. And so they say that even massage gently on the skin will ultimately affect even the bone. So massage therapy is not just to affect muscles specifically or fascia, it's affecting everything. If a client were to come into your office and they're sweating and their left arm hurts, and they go, oh, does your left arm hurt? Yeah. Say, I can massage that. I can make it better. Well, if they're having a heart attack, if we're massaging the symptom, will that take care of the real problem? No. But many massage therapists are doing that. The client comes in and says it hurts here, and so we say, well, I'll massage there. And we don't even ask the questions of why does it hurt there. They come in the door and their shoulders are rolled forward and they've got tingling in their hands, and I ask them what they do for a living. They do data input and keyboard all day long, and I can massage right where it hurts, or I can deal with the actual problem, which is probably their pec muscles, dealing with the impingement on brachial plexus and getting that to let go, which will take care of the mid-back stress, which will cause the occiput to let go. So we want to educate them as well as we're going through. This is your only psychology for the weekend. That is, just like a bad relationship, the bully seldom feels the pain. It's the abused that feels the pain. So when someone points to their pain, in reality, it's probably the abused, not the instigator of the problem itself. We'll talk more about that in a moment, and what that actually means. But if a client comes in the door and they've got an occipital headache, a bad therapist says, oh, I'm going to massage your foot, man. And a good therapist says, well, I'll massage your occiput. I'll get the base of your skull taken care of and get that done. And a great therapist says, why? What's going on? What needs to be taken care of? How many of you have heard the term tensegrity? Okay. Well, it means tensional integrity. And really, it's like that ball at Epcot Center. It's got that big silver ball. That was a few weeks ago. I was actually in Orlando. I said, you ever seen that ball? And I looked at my screen and they go, it's right across the street. Okay. But that idea of that ball is supposed to be, there's actually a ride inside, but it's supposed to be the theory of tensegrity. It's tension, it's gravity, and structural stress that holds that up. And it's the same with our bodies. We're basically like a circus tent. I tell my clients, you're a lot like a circus tent, and it's a very thin, svelte circus tent, but you're a lot like a circus tent. That means you have poles, which are like your bones. You have ropes, which are like your muscles, and you've got the fascia, which is the actual canvas. And if you just had poles, could you stand up? Well, if you shoved them in the ground, maybe, but otherwise, if you're just bones, you're going to fall to the ground. And if you're just muscle, you could be like the Michelin Man, flex for a few seconds, but you're going to fall back down. So we have to have a tension against a firm member, against the bone. Without that, we can't stand up. Which means, in reality, even when we're relaxed and we're standing, we still have tension. So tension's not bad. It's just that when you have too much tension on one side, what happens? You have to have a balance. The other side gets tight. If you have the circus tent and we've got tight ropes, and the pole is in the wrong spot, you would loosen the ropes in the tent, you'd move the pole, and then retighten the ropes. And the body's the same way. If you have super tight muscles, because you have something going on in the spine, they're bracing and protecting the spine, you want to loosen the muscles, allow the chiropractor to mobilize and get the joint moving. There's also a misnomer, I think is the best way to say it, in chiropractic. You have the term of subluxation out there, and it's not really a good word to use. Matter of fact, if you go to the World Health Organization website and look up all their medical terms and definitions and type in subluxation, there's two definitions. There's the real one and there's the chiropractic definition. A true subluxation is not what's really going on. Typically there's a lack of movement. There's some kind of a fixation in the spine, and that fixation, this is a simplified version. Chiropractors don't like it when I talk about this, but it's true. You can ask them. But when you have a fixation in the spine, what happens is a local change in the metabolism, which becomes toxic and caustic. And that caustic aspect of that, the localized aspect of the joint, irritates the nerve causing pain. And so when a chiropractor gets that moving again, metabolism of the joint changes, it gets the pressure off, it starts to move, and then that irritation goes away, then they're healthier again. So again, movement is life, lack of movement is death. When a chiropractor mobilizes that and gets the fixation to take care of itself, you've got a much better situation than a fixation or subluxation taking place. And so a lot of people go to massage schools, and they have these plumb bobs, and they've got the wall charts, and they're analyzing the person's posture. And if a person walks in the door and they've got one shoulder up, you go, bet your shoulder's tight, right? Keen sense of the obvious. Well, I think it's funny that we're spending so much time on evaluation of posture, because theoretically, if every single muscle in your body was tight, you'd have perfect posture. Think about it. If every single muscle in your body was tight, you'd lock up and you look at the person and go, oh my God, look at that. Perfect posture. You're good to go. Thank you. Right? We'd be so locked up. So don't get so hung up on posture. Use that as a general understanding. But if they have perfect posture and you touch their body and it's completely tight from spasm and tonus, obviously something else is going on. So don't just look at that. Or, when I look at chiropractors, for example, we'll look and evaluate people. Well, if the person always sees them, the client, in the afternoon, at 5 o'clock in the afternoon, and one day the person only can see them in the morning, and the person comes in, their posture's better, like, oh my gosh, they're getting better. Well, no. When you want to buy shoes, when's the best time to buy your shoes? End of the day, your feet swell. Ever notice when you get in your car and you adjust your car mirror in the morning? Oh my gosh, you adjust it. End of the day, you're like, adjust it again. You change height? In the morning, you're like, take it on the day. End of the day, oh my God. Next morning, take it on the day. Next day, so our bodies constantly change. And so you can't just look at that, because our bodies do change posture throughout the day. So it's still important to look at, but don't put all your emphasis on just the analysis of posture. Also, the same circus tent analogy, if those ropes are locked down and tight, what happens to the poles? Well, they're under massive stress. And so that causes injury to the joint, it causes stress in the joint, and that kind of a thing. So many of you you work with chiropractors, for example, and ideally you want to have an evaluation by the chiropractor when the client comes in, the patient comes in, they look at the patient, they see what's going on, and they do the evaluation. The massage therapist works on them, loosens up the muscles. The chiropractor can simply and easily put the person into motion again, and then go from there and be able to help the person out. If you do the chiropractic adjustment before the massage, it usually takes more overall treatments and more overall massage, and it puts also more stress on the joint itself. So there's a lot of argument on that and theories, but we'll go with that one for this case. We talk about muscle tension in the body and balancing the body out. When someone they have a muscle that's overly tight for a long period of time, it really can become problematic, and it happens to come down to nutrition as well. I had these two bodybuilders, there was a boyfriend and girlfriend, and they were both bodybuilding, competing at the same time, and they both were on an amazing imported drug from Russia, anabolic steroids. Amazing stuff. And their body fat was way down, and her voice was down here, and he's just Mr. Olympia, just perfectly cut. And she was a massage therapy student at another school at the time, and she could just, her huge muscles, she could just flop those muscles and flex them into hard rock. He, on the other hand, hurt my elbow to work on. I'd work on his back, and it just hurt my arms. Oh my gosh, and he would never ever be able to get soft. And I said, unless you're able to relax those muscles, you won't be able to truly get the results that you want, and you're going to start to have problems. Oh, I'm fine. I've worked my whole life to get this hard. I'm not going to get soft now. I said, okay. So I saw him about a month later before I knew what roid rage was. And I asked him, I said, so are you atrophying yet? He said, what? I said, are you atrophying? Are your muscles getting smaller? How'd you know that? I said, well, your muscles were so hard and stressed so long that they actually can block the circulation and keep your muscles from getting the very nutrition they need to get strong and to grow. And so if your muscles can't get soft and they can't come to a relaxed state, they can't actually get nutrition and they can't grow as you're asking them to. So you need to learn to relax so you're able to be a good bodybuilder with super hard muscles. And he didn't get it. And he ended up dropping out of bodybuilding because he wasn't getting the nutrition that he needed. So be aware of that when you're working with your clients. Part of our job is just to get their muscles to get the nutrition it needs, just by circulation and relaxation. I'd like you to do an experiment for me. I want you to go ahead and tilt your heads back and look at the ceiling. Just tilt your head back, stare up, let the head just dangle backwards. And I want you to feel the gravity pull on your neck. And the longer you dangle your head back, the more gravity you're going to feel and the heavier your head's going to feel. Just hold it there for a few moments, and you might feel some old pain kind of work its way in from the past, but just kind of let it dangle back there and feel that weight. Now I'd like you to bring your chin to your chest and let it drop down. Let that weight just hang down there. And of course, the longer you hold it there, the more more gravity is going to take effect, the more weight you're going to feel, more intensity. Old injuries might start to creep in, but that weight's going to increase. I want you to bring your head slowly up and bring it right to that point where it's not falling backwards, not falling forwards, just right in the middle, and you have a perfect balance. Your neck where it's at, how many of you have your neck exactly where it was, exactly in that position versus before we did this? No one. So if you as massage therapists don't always use the best posture, we end up using our muscles as anchors versus movers and keep our body in good posture. It takes stress off of our body. If I walk around like this and go, man, my neck really hurts. You're going, well, duh, right? And so as we use our body improperly with bad posture, it really makes a difference in our muscles. Our muscles have to work harder. They, of course, they become anchors and not just movers. So our clients need to make sure they're doing the same thing. We can do great massage, but if they go back to their old habits and old postures, it's going to make a big difference in the recovery. In my office, I used a cardboard box with a pencil, 3 rubber bands, and paper clips, and I'd hold this pencil vertical with those 3 rubber bands, and I'd have that. It's a very expensive investment. But I'd pull one side and show my client, the pencil would lean over, and I'd say, this is you. And then the other side pulls tight again and pulls that pencil back up, and this is also you. So we have this good posture, but your muscles are all tight. So when you come in for treatment, the reason I'm working on what you didn't ask me to work on is because I want to bring that body back into less spasm and help you out. But it's not always about posture. So make sure you understand that. So also this weekend, when you were in massage school, you had your flashcards you used to memorize, muscles, origin, insertions, and all those things. Get those cards back out. Because I really want to make sure as therapists you know the antagonist for every muscle. At least know the group of muscles that are fighting against you. And so when the person comes in, always work on the antagonist to get the person's balance back in. So I had a woman once walk into my office, and she was 17 years old, and she said, I heard you're really good with low backs. And I said, well, usually what's going on? She said, well, I've got really bad low back pain. I said, well, okay, and how long have you had it? She said, 3 years. I said, 3 years? She goes, yeah. I said, what have you done for the different techniques for 3 years? She said, well, the list of what I haven't done is shorter. Listening to a chiropractor, a massage therapist, a physical therapist, an acupuncturist, just the whole list. It's like, oh my gosh. And the last thing she said was a surgeon. I said, a surgeon? What did he do? She goes, he took out my tailbone. It's in a jar at home. You want to see it? Oh my gosh. So I thought if all these really intelligent people worked on her and they couldn't figure out, maybe it's something simple, right? So I said, what did you do back then that you can't do now? And she lit up, I rode horses. I said, oh, okay. I said, I'm trying to visualize, the horses, and I've had a very expensive lesson in horses since then, but I was trying to visualize that. I said, were you like galloping? She goes, we call it cantering. I said, no, I'm sorry. But she was talking about that. I'm visualizing her on her saddle, and I said, I think it must be a psoas. I said, anybody ever worked on your back to your stomach? And she goes, why would they do that? And I said, hop on the table real quick. And she hopped on the table. I did this technique in about 5 minutes, and she got up, and something happened, and happens quite a bit in my seminars, is she started to cry. I go, I'm sorry. She goes, no, the pain is gone. Then she was pissed. She spent 3 years and countless hours of time and so much money and all these things, and all it was a simple spasm. And she goes, are you serious? She goes, no offense, but a massage therapist in 5 minutes fixed this? And really? I didn't fix it, but I did we worked on the QL and worked on the psoas and broke that spasm cycle. And spasms to begin can last decades. Like the Hatfields and the McCoys. I mean, you have this fight that goes on, it's angry, and it goes back and forth and back and forth. You've got to break that spasm cycle to get the person better. So if someone comes in and they won't let you work on the antagonist, don't work on them at all, because you're just going to make it worse. So if they walk in the door and their shoulders are pulled forward, and you're going, how you doing? Well, they say, well, you can't work on my chest, just my back. Oh, no, work on the rhomboids, just only? Okay, so work on those, and they walk out going, oh, thank you very much, I appreciate it. Right? We want to get them out of that and balance those muscles out to get them into health. And if we can't work on both, it'll just exacerbate their condition, and we don't want to do that. Okay. So a patient walks in the door with a knife stuck on their head. The doctor says, oh, you have knifus cranius. Right? The patient loves it when a doctor has a name for their pain. If they can't name what they have, they feel like they're insane, or they must just be imagining things, and they feel dumb. So doctors just tell you what you have in Latin. Did you know that? I was talking to my doctor about this, and he goes, how'd you know that? I go, well, I know it. And he goes, I got to tell you a story. He goes, I shouldn't tell you guys this, but I will. So he said, I had a patient once who came to my office, and she had an itchy anus. And so he told her she had itchy anus in Latin. Goes, oh my gosh. So he prescribes this cream. And she goes to a party that night, and she's talking to the lady, what'd you do today? Oh, I went to the doctor I was diagnosed with. And she says it in Latin. She goes, oh, really? I speak Latin. You just told me your butt itched. And she goes, oh. So the point is that doctors will say what you have in Latin, and it makes the patient feel so much better that they're not crazy. You know, the second thing they do, if you get in a car accident, you will get the soup. Muscle relaxants, anti-inflammatories, and painkillers. You will get that. And then after about maybe 6 weeks or whatever, they'll finally start some therapy for you. But you've taken these drugs to get you going. The problem is that you're really not going to get what you need, which is therapy earlier on. A friend of mine once said, if I could reach my hands in the window of a car and I could start massage at the scene of the accident, the person's bloody and they're hurting, I would. And that's true. And the reason is because scar tissue begins immediately. I tell my clients, if you ever get in a car wreck, please come to see me that day. I want to work on you at least for 5 minutes. Now, I'm not going to put my elbow in there and start doing deep cross-fiber friction, but I do want to get some circulation going gently. I want to do some gentle range of motion, gentle cross-fiber friction, gentle, and I want to ice them when I'm done and cool that back down right away. But I don't want to wait till scar tissue's had a long time to build because I have to take a lot longer to get it to break up. And the longer you take, the longer it's going to take to get them well. So again, when someone gets into injury, you want to start right away with gentle work. You want to do gentle cross-fiber friction, gentle compression, gentle pins and stretches to get realigned scar tissue broken up. And you want to just get that area to get moving again. There's a phrase I've used over and over. It's in my book. It's in all my seminars, and that is, movement is life, lack of movement is death. Right? I'm not the first one to say it, but it's true. Movement is life, and lack of movement is death. And if we keep things moving, that's the best. Even with chiropractic. You know, some people say, well, chiropractor just crunched my back. Well, that's not a bad thing. Movement is important. So don't just stay stagnant. Even when the doctors will say or suggest these foam cervical collars, it's been proven in studies that those inhibit recovery. Now, if the person's got a hard plastic one on because they broke their neck, yes, those are important to wear. But the soft foam ones actually inhibit range of motion, and that slows down the healing process. So movement is life, lack of movement is death. So make sure your client keeps moving. When a client walks in the door with a prescription, and the prescription says, treat 6 times for cervical sprain and strain, why do they have that? Well, they have a prescription that says that because they went to the doctor and they said, geez, doc, my neck hurts. I got in a car wreck. Doctor says, well, go get it rubbed, right? So now, does their low back hurt? Well, maybe not yet. Now, there is the theory of, you know, unwinding, and I understand that. If I stub my toe, I'm going to walk different. My hip's going to maybe hurt, that kind of thing. There's going to be repercussions that take place in the body and the chain reaction effect. But that said, we also have the gait theory. So if I have something that's hurting so much, the rest of my body doesn't even notice that something else is hurting. That's what also is going on. So if you ever work in the yard, you're pulling blackberries, and I pay people for that. I hate working in the yard. But working in the yard, you're pulling blackberries, and you're just sweaty, and you're covered with dirt, and you're enjoying the sun, and it's a great day. And someone walks up to you and says, oh my gosh, you're bleeding. You look at your arm, there's blood coming down, you scratch yourself, and until that very second, you didn't feel the pain. Now they look at it and you're like, oh my gosh, I am, right? So when they go to see a doctor, doctor says, well, get it rubbed. Well, the truth is a lot of other things are hurt. And if you do any other massage on that person's body, if you work on their hips and you work on their back, when they come in for a prescription that says cervical sprain and strain, you've got some problems. Besides the ethical aspects of that, which isn't really a big deal, the biggest thing is insurance companies. So if it shows in your soap notes that you've treated anything else besides what the doctor said, you're not going to get paid. You may actually get an audit on past treatment. So here's my suggestion. On our website, we have a free packet download on the download section on the HossyMyeltherapy.com website. And in there is all my report forms. And in the book that we have for you, if you look in there, there's actually an example of the report. And the example of the report is that basically I say this on the very first visit when someone comes to see me. I say, Dr. So-and-so, thank you so much for your referral of Mr. Smith. Date of injury 12/27, whatever. Put the date down. Per your request, I have treated these muscles and found, and tell them what you found. You found the right side of the levator scapula, whatever. Put in what's going on in there. Make those notes and say, I also took it upon myself to palpate, not massage, to palpate the rest of the body and see what else might be involved, and found the following muscles likely involved in the injury. I found the person's got they've got the levator scapula, of course, those things in the neck, but I've also found erector spinae, or I found trapezius, bilateral, left emphasis, level 7 upon palpation, and go through the entire body and mention every single muscle you found. Then you say, I'd like to, with your approval, to work on all these muscles simultaneously, thereby getting the person out of pain quicker, with less time, less treatment, less investment, and also less cost to the insurance company. Nice buzzword to toss in there. And you put that in there and say, if you concur, I'd like to work on them twice a week for 2 weeks, once a week for 3 weeks, whatever you want to put down, once for 7 days, and once in 14, whatever you want to put down. Put your entire plan. If you concur, please sign the top copy of this and mail the other copy. Keep a copy for yourself and mail it back. And so on our website, we have the form for the report. go ahead and hand write this out nicely, or pay someone who's got a handwriting you can read, and put that in there. But you can go to your local printer with that laser copy, and they'll print you triplicate forms for that report. So do that just to save yourself the hassle, but make sure you're only treating what the doctor will approve. I have found there's no greater group of people that have a psychological component to their recovery than people with fibromyalgia. You know, you have clients that walk in the door, and not to be offensive, but if they had a big sign that says, "I have fibromyalgia," they'd wear it. You know, and if you ask them, "Hey, how you been?" "Oh, well, the pain." It's like, "No, how are you?" "Well, the pain." It's like, "What else is going on in your life?" "Well," it's like all about the pain. And if you took away their pain, they wouldn't know who to be. You know, and people, "Oh, I have the 18 points of pain." I go, "Ooh, I have bad news for you." "Why is that?" "Well, I'm taking away 4 of your points of pain today. You're only going to have 10 when I'm done, or you're only going to have 12. And now what do you got?" You see their face just go white, right? And so it's like part of who they are. It's part of their personality. And so, you know, I mentioned about the scratch on the skin, and if you keep talking about that scratch, it's going to keep hurting. I'm not saying you shouldn't talk to your clients about their pain. You want to do your intake, you want to find out what's going on, and you want to get feedback on the pressure, but don't keep talking about their pain. It just keeps feeding that fire. So I say, "Hey, what'd you do before you had this? What'd you do for fun? You go hiking?" Or, "Oh yeah, I love to hike. What's your favorite place to go hiking? What are you going to do when this is all better? What are you going to do when the pain is gone?" Talk about the future, but stop talking about, "Oh, you poor thing, it must just really hurt." No, you keep talking about the pain, it's just going to perpetuate that pain. I'm not saying don't be careful and gentle and be loving in your philosophy of treatment, but my point is if you keep talking about it, you're just going to perpetuate that issue versus talking about other things and getting their mind off of that. I call it the squirrel technique, right? That movie Up, squirrel. So if we can get their mind somewhere else, it's going to help in that recovery process. This is really important. So on your intake form, many people have a daily form, and you'll have circle your pain on the piece of paper. By the way, first of all, if the person actually tears the paper as they're really circling that, probably a psychological component to that. They've actually shown people who are happy and chase butterflies and life is good, and they get hurt, suddenly they're just, it changes their personality. But once they're out of pain, whoop, they go back to chasing butterflies again. They're happy and malleable and sweet, and right? Their personality it goes back to what it was, but pain can cause us to truly change in our personality. So that said, look at the circles of pain and then say, "Hey, could you point on your body where that pain is for me?" They say, "Well, it's on my sheet." Say, "I know, I just want to make sure I have it down right. Could you show me again?" And then what you see next is really, really, really important. Watch them with your eyes. If they point to their pain and say, "You know, it hurts right here," it probably hurts right there. Probably a tear, there's an injury, some kind of an injury at that very spot. If they press with their hand and they say, "Yeah, it kind of hurts right here," there's probably an antagonistic fight, and that's sore from that tension, that fight. There's something going on in a spasm level antagonistically. If they paint their pain, they say, "You know, it kind of hurts," and they're painting that pain on, it's likely referred pain from a trigger point. So, local, pointing, antagonistic fight with a press, and a paint is a trigger point referral. So watch that. Don't just look at a piece of paper with a circled ink on it. It tells you nothing compared to what they show you with their hands. Don't tell them that ahead of time, because it's natural and it's intrinsic in how they show the pain. So it's a very important piece to understanding pain itself and the person what you're going to be dealing with. Also, some quick things on posturology. I'll be on my soapbox a bit here. I really get frustrated when I see people teaching things around the country that are outside of our scope of practice. If I handed you a scalpel in one of my classes and said, "Here, this is how you remove a suspicious mole," I could show you that, but if you did that, that'd be slightly outside your scope of practice. Our law says you can manipulate tissue. Doesn't say how. The assumption is massage, you use your hands or your elbow, right? Not a scalpel. So if you see something that's being taught that's outside of your scope, you should not be doing that. And one of those things is diagnosing people. It's okay to realize someone has a leg length discrepancy and use that information to say, "Hey, I want you to go see a chiropractor," or go see someone to get that verified, or something that might be going on. Say, "I'm concerned there might be a discrepancy. I don't know what's going on for sure. I'd like you to have that evaluated." If I say, go through all these things and use a goniometer and say, "Oh, your leg's a ½ inch short," that's diagnostic. I can't do that. So you want to make sure you're only doing what's inside your scope of practice. So, as a massage therapist, saying, "Well, I'm not diagnosing, I'm assessing." Really? You can assess all you want. You can diagnose all you want. Just keep it to yourself. Now, if I tell a doctor, it appears, looks like the right leg is short. I did some testing. It feels like it's a ½ inch short, but I can't say that. It's outside of my scope of practice. Could you please let me know what's taking place so I can further treat? That's okay. I can tell a doctor whatever I want. That's fine. That's fine with doing that, but not to the patient. Do not tell the patient what you think is going on. So I mentioned, you've got the chiropractor says, oh, your right leg is short. Is it really short? Well, he's typically talking about the hips and your rotation and things. He does some adjustments and gets your legs back to the same length. He didn't stretch your bone out. He got you back into balance. Now, that said, if you go look at the Travell books, Janet Travell, the Trigger Point manuals, amazing books. Janet Travell was the presidential physician to John F. Kennedy. And John F. Kennedy said, if it wasn't for Dr. Janet Travell, I wouldn't be able to be president. She keeps me out of pain. So she's an amazing physician. And she has a lot of good information on Trigger Point information. It's great. But the 4th chapter of her 2nd book talks about leg length. And it talks about, how do you get a good x-ray. And again, you're not doing diagnostic work, but you can look at the x-rays and determine if something's going on and refer them to the right person. So her 4th chapter, for example, talks about the x-ray head. Where do you want that to be? Right? And so if you have someone standing next to me who's 6 foot whatever, 4, and I'm 5'9", standing next to me, could you tell who's taller? Sure you could. Now if you're standing right above us, could you tell who's taller? No. You might tell who's bigger around, but you couldn't tell who's taller. So perspective of the x-ray head is really important. And so you want to have that down at leg length if you're looking at leg length. At that point, once it's taken, you can get a ruler out and you can look, are the bones different, right? It's not that difficult, but from up high, it actually can skew those results in perspective. So she talks about that and talks about what to give to your doctor to get the important information. This next piece I want to talk about is the importance of your words. If you guys learned a great technique on low back this week, as a matter of fact, this low back technique I teach in this class is worth the entire workshop. I was known for getting people out of low back pain, and that alone built my practice. But the importance of your words with that, if you go after this class and go home on Monday and say, yeah, I learned this new technique for the back, but it's probably not going to work. Okay, that's probably going to have an effect on the outcome. If I have my bone broken and it's in a cast and I go, don't heal, don't heal, don't heal, don't heal, don't heal, guess what? I might take 3 minutes off the healing time over the course of a month, right? So the bones really don't care what I'm doing. They're just like, what's he talking about? They just do their thing. The osteoblasts are in there healing things. But muscle is affected by the brain. Muscle affects spasm. Spasm creates pain. I bet there's someone in your life, I could mention their name right now and give you an instantaneous headache. I mentioned their name, right? And so that tension causes pain. So how I talk about the muscles makes a big difference, and the importance of your words with that is significant. So we want to make sure we're at least neutral. Hey, I learned a new technique, let's give it a shot. Versus, oh my gosh, I'm so excited, this new technique is amazing, people are getting well, this is so cool, I'm going to do this, and you're going to get well, this is great. Matter of fact, if it doesn't work, I won't even charge you. Well, why would you do that? Because it's going to work, I want to get paid, but you're going to get well. So how we talk about that's really important, and they found that doctors, when they do a medical study on drugs, on the power of placebo, well, we've got the group that's the control group that gets nothing, just gets watched. It's a great group to be in. You get the group that's getting the placebo. It's not a sugar pill because that would affect glucose. You're getting an inert ingredient. And you're getting the group that gets the real drug. Well, in every study, there's an efficacious rating of placebo. There's a certain amount of people that get well from that. Matter of fact, last year in 2012, a study came out that showed that this antidepressant the drug itself was 40% effective, and placebo was 30% effective. I'm thinking for the cost of the drug, geez, just give out the placebo, and Anyway, but the point is that placebo does come back with a rating. But they found that if a doctor lies and says, "Oh my gosh, I'm not supposed to tell you this, but you're getting the real drug. This is amazing. This is so cool. You're getting the real thing. It's changing science as we know it." It doubles the placebo's rating. It doubles its effectiveness. So how we talk about the techniques we're going to do and how we talk about the expectations of outcome affects your client getting better. It's not hocus pocus. You're not misrepresenting yourself. You're simply telling your client you're going to get well. I'm excited for you, and let's get this thing done. Let's work together on this, right? Versus just, well, whatever, man. We'll see what happens. It's going to make a difference for you. Also, they've even done something called placebo surgery. So if you were to research on Bing or Google, sham surgeries or placebo surgeries, a study came out recently about men's knee surgeries, and they found that placebo surgery was more effective. And all they did was the person goes under, they got the scalpels, they're all scrubbed up, and they go, night, and the person goes under, they wake up with a scar, wake up with stitches, and the person thinks they had knee surgery, and they get better quicker. So, the point is, pretty powerful. And so what you want to do, though, in these techniques, the low back technique, when you get off the table, instantly, you'll feel the difference. Instantly, after they get off the table, there's a change. You ever banged your funny bone? Did it stop hurting the second you stopped hitting it? No. It vibrates, right? So certain techniques, whenever you relieve a nerve compression is relieved. Whenever you relieve that, it takes a little while for that change to take place. So typically nerve, when you take the pressure off the brachial plexus, for example, or off the sciatic nerve, a couple of days and you'll start to really feel the difference. Low back, instantly. So if you tell your clients when to expect these changes, that's going to make the biggest difference. And so in your books, I don't put when they're going to feel better in those recipes. You're going to have to tell them yourself. I can't. My lawyer says don't put that in there. You're not seeing the actual client. So I don't actually put the recipe for you in there, but I'll talk to you about the recipe, what usually is to be expected. So tell your clients what to expect. When they see that happens, they realize that you're telling the truth, and they're more excited about that. And don't be afraid to give a money-back guarantee. I've always done that. If this doesn't work for you, I won't charge you. And they respect that, and you're more likely to get clients by doing that. So again, let's talk about the tools of treatment this weekend. I want to put some different thoughts in your head. First of all, you're going to be looking at the same ingredients, different recipe equals a different result. So when you're watching the techniques, if you've seen something before, look for what's different. The nuances have changed. And it doesn't mean all the techniques we've learned before are wrong, but sometimes it's the smallest change that makes them better. And I'll talk to you about those. I want to give you your only Bible verse for the weekend. That is, there's nothing new under the sun. I spent a month once researching every single bodywork technique that I could find online and doing research. And I found about 3,500 techniques that exist out there. A lot of them are duplicates of the same thing, just different names on it. And so we like to put our names on things. The reason we have Hasi myotherapy is not because I wanted to make myself sound cool. It was a copyright issue. So body mechanics, the term, is already copyrighted by a different company. I didn't continue using that after I sold the school. And so I'm looking at really, a name that actually works. So I'm really the Betty Crocker of massage. It's more about the recipe book, not the technique. And it's not about me saying, oh, I invented this. But really, all techniques fall into a certain number of categories. You've got compression, you've got linear friction, you've got pin and stretch, you've got, those kinds of things. They all really fit into those categories. You've got energy work. So all the different techniques in the world fit into about 6 different categories. So it's not just a certain technique. It's, again, the application of how you do that. But I want to change your thought processes on bodywork a little bit. The first thing I want to tell you is the less a muscle is touched, the faster it responds to touch. The less a muscle is touched, the faster it responds to touch. So muscles that are touched constantly, the hand by its very nature is constantly touched. So a good hand massage is great. You don't find these significant, wow, huge changes versus a muscle like the psoas that's seldom touched and has a super fast response. The less a muscle is touched, the faster it responds to touch. Hold that thought for a second. The next is, I was taught in school wrongly, and most of you are taught wrong as well, and that is about the warm-up theory. When it comes to subacute and chronic, great. But for acute injuries, the idea of warming the area up before you treat is wrong. If you have a sunburn, a bad sunburn, and you wait 72 hours, would you want to put heat on it? Probably not. You might ignite that inflammation process again. So putting heat and warming up an area that is acutely in pain, it has some inflammation there still, you're going to ignite that by warming the area up. So with the thought process of the less a muscle is touched, you ever had a client that comes in for fibromyalgia and you just put a couple ounces of pressure on their back and, oh my gosh, you're going like, how did you get here today? Oh, I drove. Did you float above your car seat? No. Were you screaming out the window the whole way? No, because this is all I'm doing to you. And they go, oh. So they have a disconnect on what that pain feels like. Well, if you want to desensitize that area, all you have to do is just rub it like this for about a minute, and then go back in. You can go much, much deeper than you could before. So you desensitize by touching it. The problem is when you desensitize it, now it takes longer for that to react. Also, when you warm that area up, you're desensitizing the tissues, taking it longer to respond. So all that to say is, all you need to do when you have an injury is go in slow, get the work done, and get out. Don't overtreat. Don't overheat and cause an inflammation process, and now it might get out of control. Just get in, get the work done, and get out. Very short treatment times can get a much better result than over-treating and taking longer and more overall treatments. Experiment for yourself, and you'll find that usually is the case and to be true. So again, this weekend, you're not going to find one treatment that covers everything. Take a class in myofascial release. It's great, and it's great for some things, not for others. Trigger point release, great for some things, not for others. All classes are interesting. Take a class in pin and stretch techniques for the entire body. It's great for some things, but not all. So this class is not about a specific technique. It's about the application of which technique works best for which specific injury, and it's often quite different. So you're not going to find one for the whole weekend. But I will tell you this class is a combination of a number of things. You're going to find trigger point release, cross fiber friction with ice, pin and stretch techniques, which include muscle lengthening techniques with scar tissue reorientation, hydrotherapy, and myofascial release. I will tell you, I learned wrong in school when it comes to hydrotherapy. How many of you that took, trained in massage therapy and they talked in school about hydrotherapy, how many learned about using heat or ice for a certain number of minutes? Okay? It's wrong. I'll tell you why it's wrong. When I love to cook. And back in the 80s, there was this brown clear glass cookware called Vision's Cookware. And it was a mistake by Owens Corning. Complete screw up. And they thought, let's try to sell it. And so they had this stuff that you can preheat the pan, turn off the heat, and still cook an egg. Isn't that great? You ever had a boiling, you're making soup and it starts to boil over and you turn off the flame, goes down, right? No, not with theirs. It just keeps boiling and boiling and boiling. It keeps going on and on. That's not okay. When I cook, I want to control my heat. So they have a problem with conduction. The conduction of energy is what you're talking about. So if I take an ice cube on your bare back and touch you on your back with an ice cube, how long does it take for you to realize it's cold? Instantly, right? You're jumping off the table. What are you doing? If I put 10 layers of dry terry cloth towel on your back and then put an ice bag with no water and just ice alone in a plastic bag on top of those 10 layers of terry cloth towel, how long does it take to feel how cold it is? It might take you a long, maybe never. It's a great insulator, right? So you add water to that, now suddenly you've got transfer of energy and conduction. So, a wooden stick is a great way to wire your home if you don't want the information or the electricity to travel. So copper is used because it travels and transfers energy quickly. So when it comes to hydrotherapy, it comes down to result, not time. So if you're boiling your water and you're up in the mountains at 10,000 feet, it boils at a different time frame than it does on land. Actually, some recipes will say, if you're in a higher elevation, do it for this long, right? And so what you want to do is you want to go for results. So if you're icing someone and you're doing hydrotherapy, let's say you're doing cross-fire friction on the IT band, you're releasing that, we use an ice cube to cool it back down. I want you to ice it until it stays cold to the touch using the back of your hand for 60 seconds after you're done icing. If it warms back up in less than 60 seconds, you begin icing it again. You ice it for 30 seconds or so, stop, check it, make sure it stays cold. If it heats back up, start again. You do it till it stays cold for 60 seconds after you're finished. We had a volunteer for one of our techniques who just got a brand new 21-speed bicycle the week before. He rode over 200 miles in a week. He's insane. He's a great athlete, but he wasn't used to using those muscles. He volunteered for the IT band work. Well, most people take about a quarter of a Dixie cup frozen full of water to cool down their IT band. He took 2 complete full Dixie cups before it finally settled down. He was so inflamed. But the next day, he felt great. So if you don't cool it down until it stays cold, you're going to have pain and inflammation the next day when you shouldn't have. So you ice for the result, not for time and duration. Does that make sense? Okay. So this weekend, we're going to have a limited evaluation. You can go through, there's a certain presenter out there nationally with seminars, and they will tell you how for half an hour to sit here and say, does this hurt, 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 do all these testings, or write down your notes, assessing, and then do 10 minutes of cross-fiber friction, right? So I'm a simple guy. Healthy tissue, when you push on it, doesn't hurt. Crazy thought, isn't it? So if you have 4 muscles that hold the shoulder and the girdle, and I push on one that does hurt, guess what? Probably has a problem. So if it hurts, rub it. Any questions? Good? All right. Have a good weekend. Nice to meet you all. So that's my philosophy. If it hurts, rub it. So you can go through all the testing you want, but an unhealthy muscle is going to hurt when you push on it. Healthy tissue does not really hurt when you push on it, unless you're driving them crazy and being mean. So when you take it, you work in massage, break down scar tissue, and you go ahead and stretch it. Go ahead and locally, it's going to change the dynamics of the actual scar tissue itself. It increases its tensile strength. It increases its elasticity, and it makes it different. And the brain actually stops laying down more scar tissue because it reacts much more like muscle tissue, and it changes. So when you break it down, you rub it and do cross-fiber friction. That's awesome. You want to locally stretch that, and then you want to ice it afterwards. You don't want to ice and then stretch. There's a reason for that. Your fat, your scar tissue, your fascia all react like turkey soup. What does that mean? So my dad makes turkey soup every year for Christmas and for whatever, and he takes and boils that, the rest left over, and then boils it all day long and makes a great stock. Then he puts the whole thing in the refrigerator, then he pulls out the next morning the disc of fat and throws it away, which is so sad because that's the best part of the soup. But that hard disc is kind of like your fascia and your scar tissue. So if I ice down that, it hardens it in place. So if I have a doctor often will say, well, take a frozen bottle of water, freeze it, and roll your foot on that for plantar fasciitis, it's a great idea. But if I ice it and immediately start to walk on that, I tear it back out again. So you want to make sure that you let the body warm up after you ice, but also ice after you stretch, not before it. Localize, not the entire body. But if you localize your icing afterwards, it's going to make a big difference for you. So when you're looking at muscles and marbling, you've got fat distributed equally throughout on some bodies. In some bodies, you have very lean muscle with fat on the outside. So when you push on them, it's actually more difficult sometimes to work on those who have superficial fat versus well marbled. You still can get the work done, but that explains the texture when you push on people, because sometimes their bodies distribute the fat differently. So just be aware of that as you're working. Let's talk about the client understanding their background and how that affects their injury. One is you want to find out, is the injury old versus new? And I mentioned if someone got in a wreck, I want to see them that day. The sooner I can see somebody and work on them, the faster result I'm going to get. And so, I had a woman once and she got run over by a semi-truck. They pulled her out with the jaws of life. She was given the soup, muscle relaxants, anti-inflammatories, and painkillers for a year before any therapy was done. And she was young, she was healthy, she was a 23-year-old woman, and she came to me and she had so much built up scar tissue that I had to work on her, and I'm aggressive, 66 treatments before we got her well. It's pretty powerful stuff. So you want to make sure that you understand that the longer it takes before you work on them, your expectations of quick recovery are going downhill faster and faster based on how much scar tissue had a chance to build up. Of course, that depends on the injury, but in general. Also, age makes a difference. Little kids just tick me off. You often do one treatment on a kid, I'm good, thanks. And you're like, really? And us older folks take a little longer. So the older the client, sometimes the more issues. And a lot of that is actually learned behavior as well. We assume that older people oftentimes just have a lot of scar tissue, and right. Well, they found that these people who have limited range of motion, they can't move at all, when they put them under general anesthesia, have complete range of motion. They can move just fine. And so it's a learned holding patterns, learned behavior. It's not scar tissue. It's actually they're able to go where you want them to go. They just can't because the brain's there. It's blocking that. So that's where PNF and those kinds of things can help reset. You want to look at nutritional history. What kind of things do they eat? When they go to bed at night, what are they drinking? What are they eating? How do those things affect as well? And also look at activity when it comes to things like osteoporosis. If I told you I was going to hit you in the back with bamboo, you probably wouldn't be very happy with me. I have a shirt made of 100% bamboo, and if I threw that at your back, that tickles, right? And so, same material. There's a joke back when I was in junior high that my grandma knit me a car out of steel wool. It's still dumb. Anyway, the point is your bones and your muscles are really pretty much made of the same material. They're just assembled differently, so they have different features to how the structure works. But if you don't use muscles, what happens to those? Well, they atrophy, right? If you don't use bones, they also atrophy, which we call like Swiss cheese. And if you're a construction worker and you want to bend a piece of wood, you can actually make cuts in that wood, and then the board bends, right? So your bones are the same way. So having holy bones from lack of nutrition and lack of exercise and lack of stress in the bones, they're going to bend easier. We're not going to undo osteoporosis, but we can stop it in its tracks by actually having the client really work and put stress on their bones. Even a surgical tube around their neck and under their feet, just standing, putting pressure on their structure, can stop osteoporosis in its tracks. So that's really important to understand. But we can't prescribe that per se, but we can also you can encourage exercise. That's not outside your scope. So let's talk about perpetuating factors. What things are keeping your clients from getting well? I think as a therapist, I've been the most frustrated over the years when you have a client, you're doing all these great techniques and they're not getting well. You kind of take it personally. You're thinking, what am I doing wrong, right? And so that perpetuating factor is really, really important to understand. What is it that's taking place? So we want to go through a number of questions. You ever watch the TV show Dr. House or the House TV show? We can't break into their homes much. Well, you could, but we want to make sure we understand, though, by asking questions and see what things are taking place in their daily life, what things are going on that are inhibiting that recovery. So at work, we have how many hours a day are you working? If they're working 16-hour days, guess what? They're going to be stressed, right, physically as well. What's the workstation like? Is there a monitor at eye level? I was cashing a check at a bank once. I knew they had done a remodel. They had a normal bank with normal counters, and they had monitors at eye level. But no, they wanted to make this bank really cool looking. They had these beautiful cherry counters, and they put the monitors below these glass platens. And so the person was doing this, and she's cashing my check and looking down. And I said, "How's your headache doing?" She goes, "Oh, how'd you know I had a headache?" I said, "It's at the base of your skull." She goes, "Oh." I go, "You've had it for about a month." She goes, "Oh my God, you're good." I go, "How long ago?" I said, "How long ago did you guys do your remodel?" "About a month ago." I said, "Where's your monitor now?" She goes, "Oh." And you can see her just like, "Oh no." I said, "Yeah, so your new remodel is pretty, but it pretty much is causing you pain." Well, guess what? About 6 months later, all their monitors went back into little stands that held their monitors at eye level, and they started to get better. So looking at workstation use. So again, trust your hands. If they feel whiplash, treat for whiplash. If they feel any kind of an injury and the person doesn't admit to it, or you feel something's off, just trust your hands and go ahead and go with what you feel. But don't tell them that they have something or question their sincerity or honesty. Just go ahead and treat for that and just keep it to yourself. But you might be surprised at what you can find. You know, physicians, once they start to trust you, they start to trust your hands, you'll stop getting prescriptions that say cervical sprain and strain, treat 6 times, whatever the case is. You'll start getting prescriptions that say, evaluate and treat, give me a call, then I'll rewrite a prescription based on what you think is necessary. And that's when the trust begins, because you know muscles as massage therapists better than most medical doctors. Not all, depends on their specialty, but as a family doctor, that's not their forte. You know, and so massage therapists, we know this much about this much. Same as about physical therapy. Physical therapists they're doctors now. When they graduate from school, they have a lot of information, and of that information, this much is about massage. So we're specialists in our field, so don't pretend that we know everything. Make sure you're able to refer out when it's necessary. And it's hard for some therapists. We want to be all things to all people, but we don't have the training for that. So you know a lot about massage, and be proud of that, and be able to educate in a nice way, and don't try to act like you know too much. So.